Hello. Today we're in Pokhara and in the ear center of INF Nepal. That's one of the projects TERRA is currently supporting. And with me is Dr. Mike Smith and Ekdeb Debkota. It would be nice if you could briefly introduce yourself, and then we could continue how you actually got to Nepal and started with the Ohren-Camps and what the current situation is.
Okay, so yeah, my name's Mike. I'm Mike Smith. I'm a ENT surgeon, ear, nose and throat surgeon from the UK. And I've been working in Nepal, coming and going for some decades now. My first visit in Nepal was in 1976, just as a young guy traveling. And then I came back in 1980 to volunteer and work in the leprosy hospital here for a couple of years. And it kind of rolled on from there. Maybe Ekdeb will say something.
Yes. This is Ekdeb Debkota, working in INF since 22 years with Dr. Mike. And this time I would like to remember Didi Ellen. She's Ellen Finlay from Scotland, but she is the pioneer, both of us.
That's true.
Then same time I would like to remember Dr. Lucas Eberly from Switzerland. He is the backup for us.
That's absolutely right.
Yeah. Yes. So same time the family.
Yeah, they were inspiration for us.
Yes. So when we had met in 1994, we had
1994 in Western.
Yes, 94. First visit was in WRS. Then in the same time, Didi Ellen invited me to join in the camp. Then I agreed without any question. I agreed. Then he started to work with Mike, Didi Ellen.
What was the concept of the first year camps?
First year camp, the concept from Dr. Mike Smith and Sister Ellen Finlay. They thought about it. Then I think better to explain Mike Smith about it.
So in 92 I came back to Nepal to work in the Western Regional Hospital, which is the main government hospital here in Pokhara in mid-western Nepal, and to set up or help set up their ear, nose and throat department. And that was a very busy time, and we had a lot of difficult cases and different patients to deal with, but with everything, with head and neck cancer, all kinds of things. But we saw a very high incidence of ear disease, and I was training a couple of Nepali doctors as well at that time, and we were operating every week regularly on ear patients. And I began talking to the patients. I realized that even the ones who lived 2-3 hours walk from Pokhara, especially the poor people, they wouldn't easily come into the town because they had to leave their buffalo, their fields, these things. And for an agricultural person coming to a big city, they might be charged for accommodation, all sorts of things. They didn't have the money. They couldn't do it. So I thought, with Ellen, let's try going to them. So we'll pay a visit. So the first time I did any kind of visit, I walked with a medical student to a village in 93, I think it was, or
92 in Buttiban.
Yeah, in Buttiban. Yes. And then, but then from that experience, we decided to run what we called an ear camp, and we went to a small place called Beni, which is these days you can go on a very twisty road for 3 or 4 hours, but in those days it was much more. You had to walk most of the way. We had porters. We carried an operating microscope, medicines, everything on people's backs. And we arrived there, and it's a little, what they call a district hospital, but it's very small. It had 10 beds, and they were all empty. The hospital was not really functioning. And most of the staff were sitting on the grass in the sun. It's different now. Things are much busier. But in that day, very quiet. And we arrived, and I sat there thinking with my small team, will we have any patients? And the first morning, I always remember, we had 100 patients standing just for ear disease, standing in a line outside. And we were shocked, actually. And we were there for, I forget, 5 or 7 days, something. And every day we saw that number of patients. And it's
430.
Is it total?
Yes, in
and
total.
So he knows all the statistics.
17 surgery you did in the first camp.
So that first camp, we just took some very basic equipment, and we said, if we do one operation, it's a practice, we'll see what happens.
Just one doctor doing everything. OPD, surgery, anesthesia, post-optic, everything.
Because
Dr. Mike
all the surgery we did under local, even the big operations, which is not at all common in Western countries, and we found that it actually worked well, and we were able to help people. So we thought, well, this is a need, because these people would not come to the city, at least at that time. So that we were encouraged by that. So we think we need to do this regularly, and we started doing it twice, 3. I think one year maybe we did 4.
4 camp when 2006.
Even one we did in the middle of the monsoon, which was a very experience by porter and by wading through rivers and carrying things in baskets and little trucks and buses on the roof of buses and everything. We came to a place that was
huge
very
experience.
But paths that were sliding away with landslides, that kind of thing. So that was all very exciting and interesting. And I started to get volunteers coming mostly from the UK, but actually from quite a number of different countries. And so that built up over the years, and we did it until about 2 years back. We were doing it a minimum of twice a year. And
what kind of impairments actually did you encounter in these camps?
Yeah, so the patients... the age range is changing because the population in Nepal is aging now. These people because of better life expectancy, but still at least 50% of the patients are under 15, and so we see lots of things from tiny babies with discharging ears, like pus running from both ears for months, maybe years, and that's very common here. In the West, if your child has an infected ear, it's a big thing. You go to the doctor immediately, you get some treatment, normally it settles. But here, it's like normal life. They used to say, children have runny ears and they have runny noses, that's normal. But we know, of course, it's not. But they're living in dusty places, there's smoke in the house from wood fires. So we see everything from children with very bad infections in their ears to all the secondary effects of that, with the damage to the eardrum, infection in the mastoid bone, even brain abscesses, like big holes behind the ear where pus is constantly coming out. And of course, all of this brings hearing loss. So I would say by far the biggest problem is chronic infection in the ear. And then now we're getting an aging population, so we're getting older people with hearing problems. We're also seeing there are a lot of people born deaf in Nepal as well, or they go deaf at a very young age from things like meningitis, which would be less common in Western countries. So we have, we know from the statistics, which are limited, but we have some, that this kind of ear disease is much more common in Nepal than in most countries around the world, and definitely much more common than in more developed countries.
So, and were you able actually to treat these kind of patients even in the small camps?
So over the years the camps developed. So at the end we were having maybe 12 expatriates and 10 or 15 Nepali team as well. And we would see maybe 1,000 outpatients during 8-9 days. And we would operate on 100, 150 people. We would fit hearing aids.
Maximum number was 186 surgery in a week.
Yeah,
that was.
And these are not small operations. They are, some of them are
almost mastectomy and big surgeries.
Yeah, so it's not unusual for those surgeries to take 3 hours. So and we were working very long hours, often past midnight.
Long day.
Because we would
start from 8 in the morning, then next 2 in the morning or 1 in the morning. Very long day.
And we have 3 operating tables running continuously. And so we did a lot of surgeries.
Then all the staff working very happily because of to serve. That is the good opportunity to serve, especially for poor people who can't reach in the city for their treatment. So that is the encouragement, huge encouragement to work hard.
Yeah, that's true. And the visiting doctors and nurses and audiologists, they were very happy because they can really help people,
Yes.
And it's very encouraging. And so with the surgery, it's difficult because often it's hard to follow the patients up. We had to change our techniques and make things appropriate and do special trainings with them because we know the follow-up is difficult post-op. But over the years, I've seen many of the patients again, and I know that, no ear surgery can be guaranteed to give a completely perfect result, but we know that the vast majority did well. And I'm seeing patients now who I treated 30 years back. You know, they're coming here. It's not uncommon to see that. So, and we've done some statistical analysis to give, we know that we are happy with our outcomes. So we can improve it, but it's still not bad. So, and then, of course, a lot of them don't have surgery. They have medicines or health education, especially the young children. And we know, again, that if we treat a small child with an ear infection, maybe in a few months it will be back. That's always a problem in this situation out here. But that's actually why we need to improve the health services over the whole country as best we can, or at least play a part in that. So that's also why we've developed this ear centre, so that we can help with that.
And now, when we take a look back in maybe 2 or 3 years, the situation for you changed quite drastically with the construction of this hospital. How did that actually happen, and who was a major part of it?
Okay, so goodness, because we've been so involved, it's actually quite hard to think of the time scale, but it's certainly quite a few years back that I first thought and discussed with my colleagues, maybe we should have a place which is a referral centre where we can train, we can offer better follow-up and all this kind of thing. And so should we develop a centre? And we thought, which place should we put it in? And we decided Pokhara was good because there's also a lot of medical backup here. If we need a physician for advice, then those people are available. If we need special scans, x-rays, things like that, that's also available. So, and our group has a very good long history here. So I discussed that. So the other thing was that the camps were roughly twice a year, and once every 2 years, a friend of mine who is Dr. Lucas Ebele, who's a Swiss ENT doctor, was coming to us. And he was very helpful in fundraising in Switzerland. In fact, he sponsored most of those camps. And he's a very extrovert guy. And he would, in his village and his town, he would be talking to everybody. His family were well-known doctors in the village in Brunnen. And he was just great at talking to people, and they would give him money. When I asked for money, I get a small amount, but when Lucas asked, people were very generous with him. And so then one day I shared with him this idea to develop a centre, and he said he looked serious, and then he said, "How much do you need?" And I said, "I don't know, but from what I'm understanding, it might be about $1 million to build the centre and establish it." And and I think he's roughly, at that time, it was roughly the same in Swiss francs. He said, "Okay, Mike, I will undertake to raise for you 1 million Swiss francs." That was a big thing, big thing. Yes. And he knew it was going to be hard. And he worked very, very hard for that, I know, and sacrificed a lot of time. But he was as good as his word. And in fact, I think in the end they raised a little more than that. And that was enough. Without that, we would not have the centre. So I'm very thankful to Lucas. Yeah.
And construction started of the clinic, as far as I know, about 5 years ago, or
yeah, 2012.
Well, 13, but it was very rapid actually. Yeah. We were fortunate. We decided to use a contractor in Nepal who had a good reputation. It was a little bit more expensive, but it was definitely worth it in the end. And we also had some local engineers, German, Thomas Meyer and Gordon. We have some help locally as well, so they were big help in maintaining standard and quality of the build. And we have a very good site contributed by the International Nepal Fellowship, where they had some land, because land these days in the town is very expensive. Yeah,
especially in Pokhara.
Very hugely expensive. So that was available free for us. So that was, without that we couldn't manage either. So we have a beautiful site actually, because we have land around us and we have a view of the mountains, and visitors come. It's a nice place. So that's very nice. So we started. It took about 18 months, I think, to complete the building. It was quite fast.
Yes. on time it was.
And what was the concept you thought of? How should this clinic work and integrate in the public health system?
Okay, so this was a big issue. I thought a lot about that. I mean, at the beginning, I thought, should we actually try to build this within the government system? But there were a lot of obstacles to that. We thought it might be quite problematic, because most places in the world, ear disease is not given high priority in healthcare systems. And in Nepal, they have so many other issues that we knew it's not going to be high on their list. So in the end, we thought we have to just do this in a private place. But we want to integrate with the system here. So we have quite a lot of contacts with the medical establishment here in Kathmandu and locally. And we're fortunate. I think we have very good relationships. I mean, last year we had a big conference here. We had all the Nepali ENT surgeons here. We ran training and demonstrations with them. And I think everybody was very happy. And at the moment we're trying to set up a postgraduate education training with the main local government hospital, which has just become a postgraduate medical centre. So we will, we hope, once everything's signed off, become the postgraduate training centre for ear disease in this region. What do you call it? It's not region anymore, is it? Politically it's changed anyway.
Yes.
But it's this area of Nepal. We have some very positive relationships. And all our projects are run under the auspices of the ministries of the government here. So they've known our organisation for many, many years, and I think we're trusted as providing good care.
So that was the original concept, and that was also, after we finished this building process, actually the point where TERRA and the BMZ actually did become a part of the project. BMZ is the Federal Ministry of Germany who does actually development aid. And we are supporting the first 3 years, so to say, to kick off and help to establish this center. So we are currently at year 2, or almost finished year 2.
Yeah.
And could you maybe take a look back for how the first years did work out actually with the center, and what are your experience so far, and maybe also what your challenges are, and what do you think how it will be in the future?
Yes, it is. We are very lucky.
Yes.
We just finished the building. Then we didn't do any more exercise for the funding.
Yeah.
TERRA and German government already ready to support. That was absolutely, we are very lucky. We tried to use that money in correct place. We tried very hard according to plan. What we had agreement between INF and German government and TERRA. I would like to give thanks Thomas Meyer.
Yes.
He is the key person to coordinate between INF and German government and TERRA. He tried very hard from the beginning. Then still he is thankful person to do all this arrangement. Especially thanks to you, Frank, because you are encouraging regularly to do these all things. So then our request would be, what we had a dream in 3 years' time, still we are not success to achieve all those things, because there is so many other problems. Like major problems is visa. If there is a problem in visa, then we can't invite export from the overseas or the other countries. If export are not coming in the country, then we can't run medical camps. Then that is some problem still we have. If TERRA or German government is considering for this plan, then in future we can modify the camps, reach the place who are unable to come here, bring them to hospital and treat them. We can think like that.
So that's correct. So the hospital itself, the ear centre, ear hospital and training centre we have here, is a fantastic facility, and we are, as Devji says, we're very, very lucky to have had support from BMZ and TERRA, because that has been a real kind of it kicked us off, as you said, you know. It meant we could appoint staff, we could start to run. So I think we now have 26 staff. That means every level from the gardener up to a surgeon, and they're running.
And a very good team we have.
Yeah, we have a good team. It's a happy team.
Yes.
And that's really nice to see. Yeah, I feel very satisfied that we have really achieved something here, actually. And although there are many things, we have a lot of dreams, actually. A lot of things we want to see happening. You know, so many, you know, like we were talking earlier on about neonatal screening, that's to find the babies born deaf, for cochlear implantation programs, for outreach, regular community work, for training paramedicals, for health education. You have so many things we want to develop.
At least we need 5-6 years to do that.
It's a puzzle to carry it all in your head. There's so much.
Yes.
But we're looking to appoint and train some new staff shortly, especially paramedicals, so we can do regular outreach work. We're thinking to purchase a vehicle which is fitted out specially, so that there are more places in Nepal accessible by road now, or at least bad road, but you know, there are roads of some sort. So we think we can probably run some regular visits, go to visit schools, assess the children, teach the children about protecting their ears from noise and all these things. And so there are a lot of elements here that we're trying to develop a system in months or years that take most countries decades, you know. So we have the knowledge because we've seen it done in other places, but to actually drive it through in a developing country is a challenge. There's no question.
Course, yeah. And what would you say is the current capacity of this hospital? And what are you doing here? What is actually your capacity, not only in numbers, but also in kind of treatment?
Well, just in numbers quickly, we're seeing around 50 to 60 outpatients each day. We would like to double that, and it is growing. That would be our capacity, I suppose, in that terms. We're operating 2 or 3 people a day, mostly major surgery, and some of the surgeons are trainees, so they take longer to do the surgeries, and I have to supervise. But that's good. Financially, we're doing quite reasonably well. We're not sustainable yet, but we're definitely going in the right direction for that. In terms of types of surgeries, we do repairing of perforated eardrums every day. People who've had chronic infection from that. Mastoid surgery, where they get chronic infection in the bone behind the ear. We do, I think every day we do one of those operations. Yes. And we have the capacity to do 2 or 3 simultaneously because we have a beautiful operating theatre.
It's life-saving surgery.
We have people who have, really bad infections, and sometimes we get acute cases who come in. And also just a lot of outpatient work, advising people, sometimes against surgery. We have audiology running. We have a couple of very nice audiology rooms. We hopefully will build soon a lab for making the molds, it's called, for the fitting of the hearing aid in the ear. We have to develop so many systems. For example, most of our hearing aids at the moment are donated, used, or out-of-date type of hearing aids from other countries. And we badly need to establish a kind of business model for purchasing aids locally, and how to fund that, all that. Even batteries, for people who live in the hills, it's not easy to find the hearing aid batteries. So we want to establish, again, some kind of small business model where we'll train somebody from the village who works maybe in a little shop repairing radios or lights to repair hearing aids. So there are a lot of different directions we can go, a lot of opportunities. But at the moment, we're fitting hearing aids every day. We're doing hearing tests every day. We have everything from basic to fairly advanced hearing tests available. We would like to test for people because in ear disease also involves balance problems and dizziness. So that's another area that we're starting to see more and more patients, and we could do more tests for those people and treatments like physiotherapy, things like that. Yeah, there are 101 directions we can go, but I think for where we are now, we're doing quite well, but there's always more.
Yes, since 2015, 3rd November it was opened. Then since that date till now, we did about 800 surgeries completed. Then that is a huge number.
And the total outpatients is 10,000 or
10,000 something. Yeah. This is a very good number.
Yeah, that's very impressive.
Yes, that is. We also didn't know people will come like this. Then every day we trying. Then other main things is we are receiving very good comment from the client, from people, from patient. Like yesterday, Dr. Mike said, he is operating. Then after finishing the surgery, he asks, "Can you hear me?" Then immediately they Yes, I can hear you then much better than like before.
That was very nice.
Like that encouragement is giving us more energy to do
These are
more.
really precious moments.
Yes,
Yeah.
so that many good comments from the people.
And we're starting to get people travelling quite distance to come here.
Yes, in Rolpal, for example, the Thabang, it is very remote area. The Maoist established from there. It is very remote, then very hard to get there. Then the people can't get out from their place. Then we reached there last year. We didn't have any surgery capacity that time. Then after returned back to Pokhara, then we said then make a plan to bring them here for surgery. Then we already did 22 surgery from the children all under 18. Then they are coming soon for their follow-up. Already we received very good comment from them. They are very happy. They are telling good thing about their disease. It's now healing. Then it is very good. Like this, we did many other like very rich people are in Pokhara. Also, they are lack of the treatment. Then they also keep coming. Both poor and rich people.
That's an important
Yes,
point,
they have.
actually.
Yes, they have money, but there is no facility to treat. Then they are coming in after their treatment, receiving good treatment. They are very happy.
That's a very important point.
Yes.
Could you maybe tell me a little bit about the accessibility, especially for poor, as Nepal has no general public or general insurance system, health insurance. So how does it work actually that people who can't afford the treatment, and who will pay for them?
So, well, first of all, our financial model is that we charge people, most people. We do what we call a package price. So it means that included in, if this is talking about surgical patients, they will have the surgery, they'll have the post-op care, they'll have post-op visit, post-op hearing test, all that, all the medicines, everything included in a total price. So they know what it will cost, which is not the normal model here. People tend to, they always have to run off and buy a tablet or run off and buy something else like that. So they have from the beginning an idea. But of course there are plenty of people who can't afford it. And also our rate, I think, is quite reasonable.
Yes.
So partly because the building is paid for by donors, and at the moment some of our running costs and our teaching and all that is paid. So that's a help. But then the ones who can't afford it, we have we used to call it a poor fund, but now we're calling it a medical charity fund. So in that money, we have one donation from a charity in the UK, specifically for people with ear disease. If somebody comes and says, I cannot afford it, then we have counsellors who will assess them. It's not functioning at the moment as well as I would like to see it. That is a challenge for us at the moment. It's being worked on. Actually, they're just appointing some new staff to help run that. And that model needs to improve. But because we definitely want to be serving the poor, that's one of our main purposes here, and don't want to frighten anybody away. But yeah, it needs work, and like everything, it needs funding. And
it's a really integral part for the sustainability.
Yes.
Maybe you could tell me something about what are your future plans, especially in regards of sustainability and where you are at the moment, because our project will end probably around the end of 2018. And what are your plans after that?
Okay, so we know from the spreadsheets and so on that currently we are very close to being sustainable already in terms of income that we're receiving from the patients. So we think that that's definitely possible within a couple of years, that we should be fully sustainable, because like Debsy said, we have some rich people in the area as well. So we have general wards, which are actually quite nice, but we also have some private rooms, so with air conditioning, things like that, so that if people come and have money and they want to privacy, they will pay extra. So that's one way which helps us. We will start to take some medical students for electives, things like that. So they will pay a small contribution towards our costs. So we're fundraising in that kind of way. Things like we sell hearing aid batteries and we make a tiny profit on some of those things, and we try to provide good standard of materials. But at the moment, most of our hearing aids are donated free, but we're making a small charge, so there is some income from that. So we think that over time, especially if we become more famous, if you like, and more people come, that we won't have any problem in funding it. Because we are, I think without doubt, one of the best facilities for ear disease in Nepal. And so people will start to come. And even we're having patients from India, we've had them from each end of Nepal. That will help. Not that we want to take patients from other places, but we hope we're adding value and using it as a teaching vehicle as well. So I think financially we do not feel that there are any big threats at the moment. But apart from, as Ekdevji said, it is very useful to have expatriates, volunteers and visitors. First of all, they come as free service.
They are free. Then also they can support.
They're funding themselves. So that's a big help, that we're not paying a big salary to a senior doctor. So in the short term, that's useful. But also for training, because if we have people coming who are professors and things, but then it gives us a name and some kudos, so that people come, the Nepali doctors want to come to learn because they know they get international contacts. Maybe they can go on exchange programs, things like that. So at the moment we have real difficulties here in obtaining work visas and registration. And that's held us back with Ohren-Camps. And we hope we'll see some changes. But undoubtedly there are talented local people. We already have one surgeon here who's very good, and we'll develop more. So slowly we'll phase out the expatriates. I don't think we need to phase them out. I mean, every hospital in the world has international staff, and so that's not a problem. But it should be led by local people, and that's our target. That's what we want.
Yeah. I would like to add something about sustainability. They run, as Dr. Mike said, that is perfect. To replace equipment, it can be a challenge because the ear setup, ENT setup, ear setup is very expensive. Like this is a microsurgery, you need good microscope, you need others. And drill machine, then so many other equipment. That is still, because it costs huge, very expensive. Then this audio setup also very expensive. I think still we need some donor to replace equipment. That is I'm always thinking about to run hospital. There is 3 challenges. One is what is the system do you have for equipment replacement? What is the system of human resource sustainability? Then finance. These 3 component is very major and key component to sustain and run the hospital. So we have still challenge manpower and equipment replacement.
It's true. Most of our equipment has been donated over the years, and it is extremely expensive to buy new because ear surgery is quite dependent on technology, and it's like everywhere in the world, the technology is going up and up.
Yes,
there are always new techniques, better microscopes, better endoscopes, better everything. For example, when we operate on people, we normally not only try to eradicate the disease, but also, whenever possible, improve their hearing. And for that, we sometimes put little tiny prostheses, little tiny devices in the ear, which will help to transmit the sound. And for most of them are made in Germany, by the way. But anyway, they are, like in the UK price, about £250 for one piece. I'm fortunate quite a few have been donated, but that's not long-term sustainable. They are available in India, but maybe the quality is not so good, I don't know yet. But they are not so much cheaper either for the good ones. And that's not affordable for the patients. It would increase the cost of the operation several times. So those things, there are many things that need to happen, like manufacturers need to understand that they have to provide some of these things at a lower cost. Or we have to design our own. We have actually started doing that. Hearing aids, for example, in the West are very, very expensive for a hearing aid if you purchase it. And we're working with research partners to develop low-cost hearing aids. There are many areas that will be challenged for sustainability in the long run.
Yes. We have hope because we have good connections all over the world, because so many doctors already knew about this center. Then a donor like you know the reality, what is actually need. Big hope, challenge and hope, both we have.
You briefly touched already the situations of ENT in Nepal. Could you maybe, as my last question, tell me how the current situation in ENT looks in Nepal and where this new clinic now is positioned and how it's interlinked with each other?
There's been a massive change over the years, in the last 20 years, let's say, in Nepal in health services. You know, I can remember not so long back when they were very thinly scattered, not very high quality. Now, in the bigger cities, there are only a few big cities in Nepal, but they have quite a lot of hospitals, and some of them are very good. But mostly the higher quality is concentrated in the capital in Kathmandu, and most of the more experienced doctors would be there as well. There is definitely limited capacity. So ENT services generally, I mean, it's not so long back, there were probably 10 ENT specialists in the country, and some of those were not doing any real surgery, especially for ear surgery. But now I think there are something like 50 or something trained ENT specialists in the country. Again, concentrated in the capital, but there are scattered around. There are new medical schools in different parts with ENT departments, and reasonably well equipped, I think, as well, some of them. So that's definitely improving as a country. And other ancillary services like hearing aid services and audiology services, they're very limited, but they are slowly moving out of the capital. And so that's coming. I think we're positioned, well, first of all, we're a specialist ear centre. We're not doing all ENT. And our target is really to improve knowledge about ear disease and treating ear disease. And some of the centres are doing a very good job. But I think certainly in the west of Nepal, which has less centres, we are one of the major places, and probably for sure there might be one other place, but we are probably the best equipped to take that forwards. And I've always said I don't want to be in competition because, I mean, if other people are providing a good service, that's fantastic. But if they have some complicated case that they're not sure, then we'll do our best to try and help with that. And training at all levels, from senior surgeons down to health volunteers from the villages, you know, and the community medical assistants, the health assistants, people like that who are working all over Nepal. Maybe we can give them some training on basic ear health. And we want to actually shortly we will start training some ear care, what we call ear care workers and ear care practitioners, who will be, that won't be, at this stage, it can't be integrated with the Nepali health system, but in the future I hope we'll find some way to improve primary ear health, because that's where it starts. In the children especially, and in preventative, we know that a huge amount of ear disease is preventable. Things like there are drugs that can damage hearing, which we should avoid whenever possible. The noise exposure. You know, if you go in the bazaar today, you'll find people making metal pots and metal sheets with a big hammer and no ear protection. There are so many preventable things, and treating the children's ear infections to prevent the mastoiditis and so on later on is definitely possible.
Great, thank you for your time. It was very interesting, and as you can see, the running a hospital is not as easy as you would think it would be in the beginning, and that's actually touching a lot of different areas of expertise, and it's not only the medical side, it's at the same time the social and economical side, and